Good afternoon, ladies and gentlemen. Thank you so much for joining our session, and hello to everyone who is also watching Impact online. We will today, during these 20 minutes, we will delve into the issues that were touched upon yesterday and also today. I mean globalization, I mean supply chain dependencies, but we will look at it from the perspective of the biotech industry. And we will try to answer the question, how can we use what we already have here? What is at our disposal here in Poland? And what are the priorities? And we are very fortunate to have distinguished guests with us. Konstantin Matentzoglu, Supervisory Board Member of Polpharma Biologics Group. Hello, Konstantin. Katarzyna Rolle, Professor at the Institute of Bioorganic Chemistry at the Polish Academy of Science. Hello. And Dariusz Adamusiński, General Manager of MedTech Poland. So, on a daily basis, we sense that the world has really changed dramatically in the past, and this also works within the sector you represent. The COVID pandemic, the Russian aggression against Ukraine exposed Europe's dependencies and fragility of globalization. And in one of our discussions, Konstantin, you mentioned that supply chain disruptions are a new normal. And at some point, that economic dependency is used as a weapon. Europe and member states in the past months realized that we need a European market for medicines. And I believe that Poland should play a substantial role in this discussion. And my question to you, Konstantin, would be, what do we have at our disposal? What are our resources and unique strengths here in Poland and in the biotech sector to help Poland in this discussion in Europe?
Yeah, thanks for the question. I think it's indeed kind of, and you mentioned it, it's an important topic. We have been seeing multiple crises in the past few years, very dramatic ones. But I just want to remind you of one which was probably not so dramatic. It was a ship blocking Suez. And this ship blocking Suez had massive impact on supply chains, just one ship in entire Europe and North America even. And so that's why I personally believe, not speaking about wars and pandemics coming up, but there is one event which will be very important for European supply chains, and this is the presidential election in the US, which comes up in November. And there is already now kind of a discussion in the US going on impacting like our space of drug supply, which is the Biosecure Act. Biosecure Act is against Chinese suppliers. Unfortunately, those Chinese suppliers are the biggest raw material and drug intermediate suppliers for Europe and for the US. So if all that goes through, and then we have a president-elect of Donald Trump who would even go much beyond that, America first, we will have a response in China first, then in Europe we are in big trouble, to be frank. And that will not only result in not having kind of the ibuprofen or paracetamol for our kids in the pharmacy available, it will be kind of critical drug supply which will be interrupted. And now if you sort of build the bridge to what's there already in Poland under the umbrella and framework of the European Union, and then personally I have to say Poland is in a very good starting position to contribute to that response to those global challenges. So I think when I look at the country, and to be frank, I was a bit surprised because I was not so familiar with the country, but when I spend more time here, what I'm seeing is kind of a very good level of education of people in the universities, so far beyond what I'm used to in Germany or Switzerland or France. There is a kind of well-established small molecule industry, and we, as Polpharma, are a relevant part of that. So we have very good drug substance and drug product on the small molecule world. And in the recent years, the recent decade or so, we have invested massively to ramp up biotechnological manufacturing capabilities, now with 2 products on the market. But if you look at this capacity together with highly educated workforce potential, you can easily think that in a supply chain disruption situation, let's call it crisis, just for the time being, there can be a fast response if the basis, what the country has, can be utilized in a very fast way. And we are talking, if you compare that to other countries, 3 to 4 months, to really leverage local manufacturing for the country, but as well as part of the European response, obviously. But that needs kind of now a very, very strong exchange between academia, between business and the policymakers. Because without kind of this alignment and without, to be very frank, the respective resulting financing, that's not going to work.
I have many questions, but you mentioned the cooperation between business, academia, and the public sector. It seems so, when you hear it, it seems so easy. You're all here. It seems as if you just meet, discuss, try to figure out, but at the same time, that doesn't happen, and we know it doesn't happen in many fields. Why doesn't it happen? How can we fix this? Katarzyna.
So I've heard what Konstantin already said. I fully agree that we have a lot of highly educated people here in Poland, because universities had already really, really good programs for biotechnology, for biology, for medicine, but basically what I can know, it's biotechnology and biology. And close collaboration between the academia, between the science and business would be, or could be, or should be the answer for your question, for the first question. So it's not easy, unfortunately. It's not easy because we are living in a separate worlds, I would say. I think what we can do now and what we do is the writing joint grants. But we will write a grant when there is a call. Someone should announce this call. Someone should build a program for a business and for academia, for a science. So we need something should happen on the top. I mean, some governmental support or whatever at the level of Ministry of, I don't know, Health, Ministry of Science, Ministry of Development and Technology, to somehow bridge these completely different fields, to build maybe some list or some database of the competencies, because what we have in our laboratories, we have, I bet that there is dozens of projects or dozens of almost, maybe not ready, but still quite good products, therapeutic solutions, which needs to be only put into the business, to put into some improvement or some further development. So it will shorten the time for development of the new technology rapidly, I would say. So, but we have no chance to meet the business. The business has no chance to meet us. So we need to create some space for this meeting.
At a meeting we held at Polityka Insight last year, I came across the opinion that there is lack of sufficient knowledge flow between business and academia and business. And would you agree?
Yeah.
Yeah?
Yeah, but because I feel like sometimes we speak in a different language. We develop the solution, but we basically, maybe I shouldn't tell that, but we don't care about the money. So, you know, we try to be as flexible as only possible. We try to be as innovative as only possible. So we basically don't calculate whether it will be, whether we will have an income or not. Mm-hmm. But we have someone from the business side which calculate. But what we can learn from the business also is this calculation, of course, the need of the calculation, the need of the proper investigation of the whole product, which is fine. But then, or that's why we have to meet. That's why we have to meet to bridge all of our knowledge.
This common language is especially important in times of crisis, right? When
Yeah.
you need to, what we saw during the pandemic, right? Because when suddenly you need to work closely together, and I guess this is such a moment. Dariusz, Konstantin mentioned the Biosecure Act in America. We also had different initiatives in the past months within the European Union. And because we had the list of critical medicine, we had the communication of the European Commission on and the critical medical alliance and all that. But at the same time, the medical devices industry is also very important and needs support both in Poland, as I understand, and in the EU. So my question is, what we have in the drug sector, do you see that happening also in the medical device sector? And it's quite important because the three of you represent three puzzles of the picture of strengthening and this ecosystem that is critical to supplies and drug security.
Thank you for the question. I must admit that we are MedTech sector. We are the most worst situation in biotech, due to the fact that let me answer your question according to some market report. I'm a fan of statistics, and I'm going to use some figures to show you the gravity of the situation. So in Europe, Europe is the home for 35,000 companies from our sector. More than 1 million people are employed in Europe in our sector. It's slightly less than pharma business, which is famous pharma business. But as far as concern of Poland, we have only 30,000 people in our sector. In other words, 8 people out 10,000 in Poland engage in this sector versus, for example, Ireland, when there's 10 times more. So we don't have sources, we don't have factories, we don't have any bright idea how to solve, how to repair this situation. On the other hand, I see what you mean. Poland is the fifth biggest market in Europe regarding the consumption and utilization of medical technology in Europe. And such a big discrepancy between employment and the market size demonstrate that there is quite big potential of development of local production. But it sounds easy, but to be honest, Poland is not the home to production of medical devices on the strategic importance, and not be till the government will invest some source insurance to give the grain line to platform for development of this sector. On the other hand, in Europe, 90% of the turnover is generated by small and medium-sized companies. Of course, many Polish small and medium-sized companies are struggling, some problems, are face a lot of obstacles because of the lack of the clear legislative and tax regulation. If you have to sell, product, medical devices, you have to notify this product. And we don't have in Polish body, which is certified medical devices on the classes C and D, the high classes, which is quite important for our security of our business. But a foreign notifying body, of course, they can do that, but the queue is extremely long, costs are extremely high, and additionally, there is no equal treatment Polish employees versus Western companies. So next step, what should we do? We have to establish local notified body to speed up ideas, to speed some products on the Polish market. And last but not least, startups. I can see there is a lot of young entrepreneurs who already established some companies. At the moment, are looking for the support from the governmental institution, agencies. They're moving from one to another, asking one expert to another expert, and finally decided to move to foreign market and find the support from them. That we are losing a lot of new ideas, new smart entrepreneurs who move their business to other countries.
I wanted to ask you, Konstantin, you have a comment as well. How, because maybe this is also interesting to the audience, how advanced are the molecules that we can here produce in Poland?
Maybe to first bridge what Kasia and Darek just said.
Yeah.
I think both of them are super spot on.
Yeah.
There is no aligned incentive to co-create. And if I look at our business, and we do a lot of medical device development actually, but we are not doing it with a Polish partner. We are doing it with partners outside, in Europe or in the US even. And the reason is that indeed, that does not have sufficient focus. Whereas kind of the drug substance part, so the active ingredients and the research, I think is very good and gets independently kind of decent support, but here it's really create the right incentives for aligned interest, because this will create ultimately the resilience you need to be fast in disrupted supply chains. You have to create the right basis plus the aligned incentive, and that costs money ultimately. And I think we have seen very good examples for that in the past, in Europe actually even, where this worked. It was part of the pandemic, but nevertheless, it could still serve as a blueprint, as a learning curve. And if you look what, for instance, Germany did, Germany is super bureaucratic, but there they did well. They aligned academia, who provided the innovation, with kind of the vaccine manufacturers, plus the medical device companies, who did ultimately the super important, not only testing, but develop the devices which are necessary for using those drugs. And this created the combined incentive through money. And I think ultimately this is something which needs to be considered. So the policymakers have to facilitate that and have to make sure that the Polish industry as part of the European landscape gets sufficient funding. I mean, you referred earlier to the chip industry, right? We are seeing that already happening. But I think if we talk about supply of critical drugs, and to be frank, this list of critical drugs, it does not really have the critical drugs. It has the basic drugs everyone uses all the time. But there are a few critical drugs even now. I mean, if you suffer from a stroke, and knock on wood, hopefully you won't, there is no chance currently that you will get a thrombolysis here in Poland. And the reason is that the supplier is currently not supplying their drug to Poland, because the reimbursement is too low. There is no local manufacturing of this drug in Poland. If there would be a solution. And this is completely independent of Trump, war, pandemic, and so on. This is just pure commercial isolation. And I think that's something we ultimately need to work on jointly, and we need to work on quite fast, because things get more volatile.
Do you see, when talking about the funding, do you see the Made in Europe policy announced by Ursula von der Leyen, growing protectionism, de-risking policy? Do you see that as a chance for the sector to get more funding and to put more focus on? You said the chips industry, we discussed it earlier, has a great focus in Europe, and also it's of interest to the Polish administration. And we very often see the comparisons to the bio, not here in Poland, but in Europe, to the biotech industry. Do you see this as a chance?
I mean, personally, I feel it does not get the due attention, because if you look into the chip thing, funds are already earmarked, budgets are allocated, money is flowing. In the biosector, we saw massive funding during the pandemic. Post-pandemic, it's gone. Yes, there is European policy about supplying critical drugs, but personally, I have a hard time to really take that seriously, because ultimately, if I look what kind of money comes into Poland out of that policy, zero.
Yeah. Katarzyna, I saw you wanted to also, so we're wrapping up, so
yes.
if you could...
So I will say, I see the chance, and I would like to see this chance, because I think this is the urgent need, just to, to work on the new solutions, medical solutions. We just need to do it.
As a sector, we need the support from the governmental institution, agency of the medical outmit, and other organizations who should support all local initiative and support and protect and bring some solution how to increase the interest of the other parties in Poland. So support from the national governmental institution is needed.
We could discuss this further on, but we are out of time. So if anyone would like to discuss this further, our panelists will be, I think, open to discussions in front of the room. Thank you very much for joining us. And I think this is just the beginning of the discussion and looking for a common language, but also an incentive to find that aligned interest that you said you all need as a sector. Thank you very much, and see you around. Bye-bye.